So next up, we have Ras Labs and Lenore. So come on up and we'll get you ready.
Hi, I'm Lenore Rasmussen, the founder of Ras Labs, and I'm so glad to be here tonight at the Venture Forum. Here's why I started Ras Labs. When I was in grad school, I'm from an agricultural background. One of my cousins had a horrible farm accident. His doctors feared gangrene and amputation. As a resident scientist in the family, I was put in charge of looking at prosthetics, and I was very disappointed in what I found. You had the mannequin kind of prostheses that looked great but weren't functional, or you had your mechanical devices, ankles that you could hear clicking, hooks for hands. The prosthetics of today are much more sophisticated, like the robot hands, but they still don't look realistic. I wanted the best of both worlds, and as a young chemist, I felt like if you developed a material that responded to a stimulus, such as electricity, you could combine form and function. It wasn't as easy as I thought it was, but today, Ras Labs is making synthetic muscle, which is a class of polymers called electroactive polymers, or EAPs, that contract and expand with controlled voltage. We are a platform business, and this is how we are first applying our technology. We began working with United Prosthetics, which is the largest clinical prosthetic company in the Boston area, serving most of the Boston Marathon victims, including pediatric patients. We found that the biggest pain point was the interface between the hard socket and the residual limb. This is handled by what's called a prosthetic liner. Currently, prosthetic liners are static, while the residual limb changes over the course of the day, much like our shoe size changes from morning to night. So, how amputees are handling this is literally using layers of cotton socks to add or remove layers to deal with that residual tissue fluctuation. We can do better than that. Right now, we have a material that shape morphs, that gets bigger or smaller as needed. Our first go-to-market product is in collaboration and through funded development with the largest prosthetic liner company in the United States and with United Prosthetics to embed our synthetic muscle as pads in strategic zones within the prosthetic liner so that we are forming with our business partner a dynamic, continual fit, perfect fit prosthetic liner. This will improve amputees' lives. Our strategy is to use our patented core technology to create game-changing, competitive, and disruptive advantage to our B2B partners so that they can advance the standard of care for their patients, their customers, and improve their lives. Here's where we are right now. We have a signed, funded joint development agreement with the largest prosthetic liner company in the US. We are negotiating joint development with the largest global orthotic and prosthetic company in the world. They are interested not just the hard socket human interface, but other potential applications using our synthetic muscle. In the pipeline, we're talking to robotics companies, brand name recognized athletic shoe companies for insoles, electronics companies, advanced material companies, and chemical suppliers. For testing and scale-up, we're using UMass Lowell and WPI. Ras Labs has a strong and dedicated team and fantastic advisors. I'm the founder and majority owner. My corporate experience is Johnson & Johnson, and I also teach part-time in the fall a graduate course through the robotics engineering program. Simone Rodriguez is our product developer with a background in biology and electrical engineering, including flexible electronics. Jill Wattels is our key business advisor, and she is a closer with experience from small businesses to multinational corporations. We have built a financial model based on our history and pipeline projections. Our plan for the next 2 years is based on grants and investment. For the somewhat conservative model, we expect to be cash positive in 2019. Ras Labs' vision to combine form and function is doable now. The robustness of Ras Labs' synthetic muscle allows it opens up for a substantial and the growing robotics market.
Awesome. Thank you, Lenore. That was so good. We
Okay, thank you.
apologize for the little inconvenience there, but fantastic job. So a quick round of applause, right?
Thank you.
And now, judges, you guys have 5 minutes to ask away.
Can you just start by talking a little bit about how prepared you feel like you are to scale up and go to market? I imagine, looking at your revenue model and projections, like you may have partners that if your technology is ready to go, want you to move faster and flexible delivery. Have you thought about the manufacturing side yet?
Yes, actually, our chemistry are standard photochemistries and are scalable. Our materials aren't plexiglass, but they're in that family of polymers. So not only are we being talked to and approached to large chemical suppliers, but some of our chemical suppliers also have pilot plant capabilities and can help us with that.
Do you require any regulatory approval as a medical device?
For the prosthetics, it's an external medical device, so that's a very streamlined pathway, typically 3 to 6 months. And there again, that would be, that's more the experience of our partners. Also, we have been funded through Children's Hospital of Philadelphia, and they can help us with that process as well.
So you mentioned the word dynamic to describe your material. I didn't catch how the control of how the material is controlled, or how actually it changes. What's the signal source?
Yeah, it's called an electroactive polymer. So the stimulus for its movement or change is electricity. So there's an embedded electrode. So depending on the polarity of that electrode, you either get expansion or contraction. If you leave it alone, it'll return to its neutral state. But if you want to cycle it back and forth quicker, you can.
So does the wearer actively modulate the material, or is it done through other biological signals?
They can. We would have a switch that they could control, but typically amputees tend to shrink over the course of the day. So our first generation for the prosthetic liner inclusion would be to have it contract overnight, as a charge cycle, and then in the morning, and that also makes it easy to put on the morning to dawn, and then at 0 voltage, let it expand. Go back to its neutral state, but if it needs to, it can be expanded either more or at a greater speed. And if there's an opposal, like swelling instead of shrinkage over the course of the day, that can be reverted back.
Can you talk a little bit about the amputee experience? On one hand, you're taking away a pain point of the sock liner, as you mentioned, and on the flip side, you're asking them, it sounds like, to add a new piece of their day, which is charging this, or charging it once a week.
A lot of the more sophisticated devices actually need charged anyways overnight, and this is a very low energy output draw, so it's something that's done anyways. This would just kind of modulate and make a perfect fit prosthetic liner as part of their overall experience.
You're hooking up to an external power source, or a power source that's in the rest of the prosthetic for that?
We're hooking up during a typical charge cycle for not just our liner, but for the prosthetic device, while it's not in use. So, but that said, our materials take a low draw, so if they forget to, we have enough battery, a little amount energy draw, if you will, that it can last 3 to 5 days without a charge.
Can you tell us a little bit what you believe the price point for the entire system would be? That would be the liner plus the electrical control as well as the battery, the price point to the consumer, to the patient, to the amputee, and perhaps even compare that to what an amputee is paying today for, albeit an inferior system, the socks.
Right. Well, what we're doing is getting rid of the socks. What they're paying for is the socks and the prosthetic liner, and this is about $600, and they get 2 of these per year through the insurance companies, plus, I kid you not, 12 layers of cotton socks so that 6 can be in the wash. The same for these. They get 2 so they can be cleaned because they get grotty. Now, our price point for this add-on at this point needs to be We need to, our target is $25 to $35. It won't work if that gets above that. As far as the materials that go into it, we're about half that, including all the wiring and the electronics and the battery pack. Our material itself, our synthetic muscle material, just the polymer is about, but when we scale up, is expected to be about 2 cents per gram. And this would use 10 to 20 grams.
Can you talk about the experience of people? Oh, you're out of time.
Sorry, we're going to cut off the question. Awesome job. Thank you so much. Congratulations.